For decades, we've treated heart health as a strict math equation. Keep your calories low, watch your saturated fats, and limit your sugars. But this reveals a serious flaw in that logic. We see a pristine A-grade nutrition score on a typical artificially sweetened diet product. Yet right beside it, the line chart tracks steadily climbing rates of obesity, type 2 diabetes, and cardiovascular disease across Europe. The European Society of Cardiology recently released a clinical consensus identifying the physical extent of food processing as the primary driver of this disease, regardless of the food's nutrient breakdown. We are going to examine why industrial processing supersedes calorie counts, how these foods physically manipulate the human gut and brain, and how you can use a simple 4-step scale to protect your heart. The industrial journey our food takes before it ever reaches the plate dictates our cardiovascular destiny as much as the energy content itself. In countries like the UK and the Netherlands, ultra-processed foods, or UPFs, now make up more than 50% of total energy intake, driven heavily by packaged bakery goods and carbonated soft drinks. The harm starts with what is added to these products. Industrial additives and emulsifiers are engineered for texture and shelf life, but once digested, they disrupt the gut microbiota. This localized disruption triggers systemic inflammation and directly drives up hypertension. Then there is what is created during production. Intensive industrial heating forces the formation of toxic neoformed compounds like acrylamide. And before the food is even opened, plastic packaging leaches contaminants like microplastics and bisphenols directly into the meal. But the most damaging element is what gets destroyed, the food matrix. This is the natural physical structure of food, the intact cellular walls of a plant, or the fibrous tissue of a whole grain. When industrial processing shatters that matrix, the body absorbs the food almost instantly. This causes immediate, massive glucose spikes in the bloodstream, and because the digestion requires zero effort, it completely bypasses the brain's natural fullness signals. These mechanisms combine to create a product that successfully overrides human biology. The added chemicals and the shattered matrix keep the body constantly hungry and chronically inflamed, regardless of the macronutrient math printed on the side of the box. This biological override translates directly to physical disease. Consuming more than 50 grams of ultra-processed food a day correlates with up to a 61% higher risk of developing abdominal obesity. Because the brain never receives a fullness signal and the bloodstream is flooded with rapid glucose, high consumers also face a 24% increased risk of prediabetes, followed by a massive surge in the likelihood of developing full type 2 diabetes. This bar chart demonstrates exactly how sensitive the cardiovascular system is to these products. A mere 10% increase in your baseline UPF intake triggers a disproportionate 12% leap in your overall cardiovascular disease risk. Looking at specific heart risks, that same 10% intake bump drives a 13% higher risk for coronary heart disease and an 11% higher risk of stroke. For vulnerable populations, the numbers are severe. Patients with a prior history of cardiovascular disease who consume a diet heavy in UPFs see a 65% spike in cardiovascular mortality. The most critical finding from the clinical consensus is that this deadly risk remains intact, even after adjusting for added sugar, saturated fat, and high energy density. Ultra-processed foods act as active, independent drivers of cardiovascular mortality, carrying risks that current dietary warning labels are completely failing to capture. The science is daunting, but avoiding the danger does not require restrictive math or obsessive calorie counting. It requires shifting our grocery strategy to a system called the NOVA classification. This infographic displays the 4 NOVA groups. At one end, we have NOVA Group 1. These are unprocessed or minimally processed foods with no added ingredients, things like fresh fruit, vegetables, plain yogurt, and fresh meat. Groups 2 and 3 cover processed culinary ingredients like oils and salt, and moderately processed foods designed for preservation, like canned vegetables, simple cheeses, and freshly baked bread. The primary threat to avoid is NOVA Group 4. These are the ultra-processed foods. They are industrial formulations packed with additives, covering everything from soft drinks and ready meals to fruit yogurts and many breakfast cereals. To protect your heart, Step 1 is to look beyond the macros. Stop relying solely on calorie counts and start prioritizing the ingredient list to spot those industrial additives. Step 2 is to prioritize Nova Group 1 foods on your plate. And Step 3 is to make simple swaps by identifying and replacing your daily Group 4 items with whole food alternatives. Taking control of your cardiovascular health doesn't require starvation, guilt, or complex math. It simply requires a return to real, intact food.